Hey everyone, I'm Josh Guttman from Peachtree POCUS, here to talk to you today about point-of-care ultrasound in lumbar punctures, which I'm calling the POCUS poke. Lumbar punctures are not done as frequently, and certainly as many as I did in my training, but is still a very important procedure, both for emergency medicine, internal medicine, and other inpatient and outpatient specialties. Lumbar punctures can be difficult, especially with patients who are obese. And so ultrasound can delineate the anatomy and tell you exactly where you should be placing your needle in order to assure the highest success with the least amount of pain for patients. A lumbar puncture is an involved procedure. And so the higher chances you have for success, the better it is for you and your patient. And the least you have to poke your patient, the less pain they're going to have. And so let's get into how you can use ultrasound to assist your lumbar punctures. Firstly, I'm going to mention that I'm going to be teaching the static technique, which is where you find your space with ultrasound, and then mark it. And then you will put your ultrasound down and proceed with the procedure as usual. There are dynamic guidance techniques, which I'm not going to get in today because they're generally more difficult and more time consuming. And I find the static technique sufficient and simpler. So that is what I'm going to teach you today. So is it for this patient? No, it's not for your infant who may need a lumbar puncture to rule out sepsis. In these patients, you can feel the spaces perfectly. And so ultrasound doesn't actually provide additional guidance or help in a neonate who you can feel the spaces really well. But what about for a patient who's larger and obese? In those patients, it is harder to feel the midline, exactly where the spinous processes are, and it is more difficult to perform the lumbar puncture and place your needle at the right spot. And so this is the perfect opportunity for ultrasound to be able to delineate that anatomy to know exactly where you're going to place your needle. And so your choice of transducer are either the curvilinear transducer or the linear transducer. Now, while most procedures utilize the linear transducer, in this case, I prefer the curvilinear transducer because of the depth that's needed in most of the patients that you're going to be using ultrasound for. It's easier to see the anatomy, and you don't have to worry as much about being able to see the needle with the curvilinear transducer because in the methods I'm going to teach you, you won't need to follow your needle. You just need to be able to mark the spot. So I prefer the curvilinear transducer when performing ultrasound-guided lumbar punctures. And so here's a volunteer that sat to demonstrate ultrasound-guided lumbar puncture. And I tend to do these sitting down. Certainly, if you need an opening pressure, this is something that can be done lying, or you can do the procedure and get into the space sitting and then have the patient go into the semi-recumbent to get a pressure. And so the first thing you're going to do is you're going to feel the iliac crest. And this is the same that you do in a normal procedure. And then from there, you try to find the L3, L4 interspace or midline, just like you would in a patient you weren't using ultrasound. And that's where you get started. First, you place the transducer right over what you believe the midline to be. And so there you can then delineate the anatomy. And so what you're going to see is you can see the spinous process right in the middle. Now, if you don't see the spinous process, you just have to slide up or down to be able to see that spinous process. You're going to see the transverse processes on either side, and you're going to see the dura that's right in the middle, and you're going into the dural space. And so this is the space that is going to contain your cerebral spinal fluid or CSF that you're getting as part of the lumbar puncture. And so here's what it looks like on video. And when you see the video, you see the transverse processes here. And so you're going to find the space right in between the spinous processes. Because the idea is you don't want to hit the spinous process, but you want to find right in between the spinous processes in the midline. So once you get that space, what you're going to do is you're going to take a surgical skin marker. And if you don't have a skin marker, you can also use a Sharpie because a Sharpie is also sterile. And when I work in the emergency department, I have a Sharpie available if I need some sterile markings. And so you can see with the sterile surgical pen, there was a mark placed right here, and that's right in the midline of the transducer. Once you found your space, you're doing one right above. And then what you don't see on this image is right below the transducer, you're going to make a mark also. So you're going to have two dots, one right above in the midline and one right below in the midline. Then you're going to turn onto sagittal plane. And the purpose of the sagittal plane or longitudinal axis is to be able to see the midline and find all the spinous processes in midline. And so what you're going to look for is each of these spinous processes are going to be these bones that are going to be curved and be right next to each other. Here is a video of it. You can see all the spinous processes as the user slides along the transverse processes. You want to line up those transverse processes right in the middle of your probe. And so that tells you exactly what's midline. And so then you're going to place a probe marker just on the right side of that transducer and just on the left side. So again, in the middle of the probe, just like you did in the transverse, but now in the sagittal plane to tell you exactly where's midline. And then you're going to have 4 dots, 2 from the transverse plane and 2 from the sagittal plane. You connect all those dots, and right at the center of the X, that is your midline. That is exactly where you're going to place the needle. And then you put down the transducer and you proceed with your lumbar puncture as typical, making the area sterile, and putting your drape and proceeding with using that spot as where you're going to put your needle. But what if you have a patient who is obese and you're not even sure if the needle that you have is going to actually reach the space? Ultrasound helps with that too, as there are 2 types of lumbar puncture needles. You have your standard lumbar puncture needle that comes in all the kits, but there's also a much longer lumbar puncture needle, which is used in patients who need more distance between the skin and the dural space. Now, I have these in my emergency department, but there was a time that I didn't. If you don't have these and you're doing a lot of lumbar punctures, I suggest you get these available. And how will ultrasound help you know which needle to use? If you measure from the skin surface to the dural space where the needle needs to reach, if the distance is longer than the length of your short needle, then you know the short needle is not sufficient and you need to get a longer needle. But if you don't have that longer needle available, the ultrasound here can tell you that you shouldn't even attempt the lumbar puncture because it's not going to be successful since the needle is not going to reach the space. So you'll both save yourself some time and you'll save the patient discomfort of having a procedure that is ultimately going to be unsuccessful, and you can refer them to interventional radiology in those cases to perform the lumbar puncture. Certainly, if you have the longer needles, then you would know based on this that you shouldn't even begin to try with the shorter needle. You should begin with the longer needle. So that's where ultrasound can help you. Most of the needles in the United States, at least, are in inches, and the machines have distances in centimeters. So you need to convert the inches to centimeters or vice versa. You could find the lengths directly on the packaging. So remember how I mentioned at the beginning that you would feel the iliac crests, and then from there you would find the midline. But what if on a patient you can't even feel where the iliac crests are? So what can you do in those cases to know exactly where you should put your needle? Because you want to find the L3, L4 interspace, which is the typical space for a lumbar puncture. But if you can't feel the iliac crests, which are your landmark, how are you going to know? Ultrasound can help there too. Here is a long axis or sagittal plane where you see the spinous processes line up. So here the ultrasound transducer is in sagittal plane, and you can see the spinous processes right here. But right over here in the corner is a long bone here without any spaces in between, and that's the sacral spine. The sacral bones are fused, and so it's not like you have one spinous process, another spinous process is going in order like that, but it's one long fused bone. And so once you hit that long fused bone, you say, oh, there we go, that is the sacrum. And so then if you slide cranially or up the back, you start to see the spinous processes, and then you could count back. here's the sacrum, so then this must be L5, this must be L4. And so to label it, so if you want the L3, L4 interspace, you count back L5, L4, L3, and this is the space that you're going to go for. So you'll slide the transducer up to that space and you'll make your mark in the sagittal plane on the right and the left, like I showed you before. Now, you certainly can use this technique to begin with. Even if you can't feel the iliac crest, you certainly can feel welcome not to do it that method and just do it this way, but I wanted to show you the different methods that can be utilized. And so remember the static versus dynamic technique. I'm showing you the static techniques and not the dynamic techniques because I find the static techniques technically easier, especially when it comes to doing the procedure, but you certainly can do it dynamically by putting the sterile probe cover and having sterile gel like you're doing a central line and following your needle, or using a paramedian approach, which you certainly can look up, but I'm not going to show you here. Remember that you're going to mark in 4 places, in transverse and longitudinal. X marks a spot, and you're going to make sure to measure the distance between the skin and the dura to know which needle you should be using, especially in a larger patient. Thank you very much for joining me on this lecture, and I'll see you next time. If you enjoyed that lecture, then make sure to check out the rest of the Peachtree POCUS catalog. You have the core exams, which are the main point-of-care ultrasound indications that you need to know. And then there's the Core Plus, the expanded package, or just buy courses individually of topics that you're interested in learning more about.